All right, welcome everybody. We are starting our afternoon sessions today, and we start with talking about HFMA Enterprise, and we actually brought someone from HFMA Nationals to join us, and then we're going to talk about our chapter and our certifications. So let me introduce to you Jennifer Vandenberg. She's an account executive with HFMA Enterprise Solutions team. She's been with HFMA for over 13 years and has her bachelor's degree in business marketing. And after she gets done speaking, we're going to talk to Jennifer Rich, who has over 20 years of healthcare experience, now working in hospital billing with a focus in revenue integrity. She's been an active member of HFMA since 2016 and has served on the Oregon HFMA certification team since 2019. She is CHFP certified. So please put your hands together and welcome both Jennifers.
Thank you, Sunshine. Whoops. Can you hear me? All right. Okay, so we got the afternoon session. So hopefully we'll keep you guys awake. I have a couple of videos to help with that as well. So what I'm going to cover is, pretty much all of the HFMA benefits. So the enterprise membership benefits, and then, even the individual membership benefits. So as far as, HFMA, our mission is to lead the management of the healthcare finance industry by bringing together our hospitals, physicians, patients, and health plans. So that's really our mission. And so who we are at a glance, and for those of you, all of you are familiar with who HFMA is. One of the exciting things to note is we are at 110,000 members, so our highest membership ever. We have over 270 enterprise membership clients, 59 chapters, over 20,000 CR certifications, 3,600 CHP and fellow. 91% of our members are senior financial executives, which is exciting, and then I'm going to show you how our membership is actually expanding across organizations. We have 8 certifications. So you might be saying, wait, there's 6 certifications. I'm actually going to announce 2 new certifications to you today, which is really exciting. I just got the go-ahead to announce those, even though they're not available quite yet, so I'll talk about those as well. So 4 out of our 10 members of organizations are executives, and we are seeing this expand, certainly with the enterprise membership. And then we have over 5,000 attendees at our annual conference, which is our annual national conference. So as far as career level, this just kind of breaks out the career level by professional level, management level, executive level, and then other members of organizations. One of the cool things to note is with the enterprise membership, we are seeing a lot of people that usually are not getting involved with an HFMA, getting more involved in the education with the enterprise membership program. So as far as the membership and kind of how this came about is years ago, HFMA looked at our membership and we realized that organizations were not usually using all of the benefits that HFMA has to offer for education, for training, and the reason being was because of cost. So we actually came up with this enterprise membership program, which there's, I think, quite a few organizations are involved within the Oregon chapter. But I really like this slide, and I actually pulled this slide from our onboarding. So with the enterprise membership, some organizations will just open it up for employees to kind of consume the benefits that they choose. But during the onboarding of any enterprise, of the enterprise membership program, we actually will show this slide and say, hey, what are your organization's goals? What are you looking to achieve with this enterprise membership? So some organizations might start off with a couple of these points, maybe one or two, and they'll certainly grow into more. So continuing education and training, career development, setting standards, so putting coursework in place for different departments to use and use that for career ladders and professional development. So these are just some of the goals that we list, and we have a team dedicated with all of our enterprise clients to help you to put together these goals and to help you achieve the goals with our quarterly reviews and reviewing kind of your engagement and everything. So I have a quick little video that hopefully we can get to play here. Nope, it's not going to work. Sorry. Well, nope, it's not going to work. Where did I?
You have to exit out of the PowerPoint. Go back to PowerPoint.
Here?
This one over there. And then this tab here. Oh,
Sorry, guys.
this one over here. Oh. So go back to the PowerPoint. And then this tab here. That one.
All right.
And exit.
No, I think it's.
Well, you might have to click on that to open it up.
All right, well, maybe we're not going to play the video today. So it was just a short snippet video that HFMA has available for kind of educating of the enterprise membership program. So it's basically everything I'm going to talk about, but in a 2-minute video. So as far as HFMA's member benefits, and the benefits are the same with the organization membership, similar to the individual membership. So a lot of you are probably familiar with these benefits, but with the HFMA benefits, with the enterprise membership or even your individual membership, you're going to have access to HFMA's magazine. So you can consume the hard copy version. That can be set up within your profile. A lot of organizations will opt out of getting that hard copy version because their mailrooms get inundated with the magazine. So you can certainly consume all of the internet versions of the magazine. We have our daily newsletter, chapter membership, which I'm going to cover here a little bit more detail. A great way to get access to local education, to drive future leaders, networking, podcasts. So the podcasts are our award-winning podcast, which features industry leaders, focuses on current events and important topics. All of our talent management and development tools, which I'm going to spend some time, and then Jennifer's going to spend some time talking about our certifications, our special reports, white papers, regulatory updates. I did leave a white paper, which you can get at the registration desk, and it really talks about the value behind organizational education and using that to drive performance. I'm going to spend some time covering our community pages, the social networking within HFMA that's available to HFMA members, and then also all of our online education. So with your membership and then your enterprise membership, you have unlimited access to all of HFMA's education benefits, so webinars. So the live webinars are great for continued education credit, so CPE, CME, CNE. Also, a lot of organizations might use this as an education tool. If there's a, for example, if there's a specific webinar that HFMA maybe previously recorded, you can actually have your team members listen to the webinar and kind of use that as a discussion point for team meetings. Also, you have unlimited access to all of our online learning courses. So there's over 35 courses. At any time, you can go into our website and you can do a search on a specific topic, and it's going to pull all of the resources behind that topic. So, for example, denials management, it's going to pull up all of the education around denials management, all of the webinars, all of the seminars that HFMA provides. One of our most popular courses is the Business of Healthcare. So this is Module 1 of the CHFP, and I have another slide that covers this one in a little bit more detail, and then I know Jennifer is going to cover it as well. This is a really popular course. It's Healthcare Finance 101, and it focuses on cost, payment, revenue, and delivery models. A lot of organizations might use this for people that are not familiar with the healthcare industry. I have an academic client that uses it for their new leadership academy. So this is a really great course. We also have a scaled down version of this course that was just launched last year, which is available, and it's only a 3-hour study. That is a fairly new course as well. Patient financial communication. So this is a really popular program. So it can be customized for your department, how to effectively communicate with patients to increase patient satisfaction. It covers advance of service, emergency department, and then time of service. So that's a really popular one. And then Patient Access Essentials is another patient access course. So to the right there, you can see the digital badges. So once you pass your learning course or any of the certifications that Jennifer and I are going to cover, you're going to get access to your digital badge. So your digital badge is going to contain metadata behind your new skill set. So you can add this to your LinkedIn page, you can add it to your email signature. So a lot of people get excited to earn their credentials. And one new thing to mention is you can get your digital badge real time. I think in the past it used to take 2 weeks before we would issue that, but now it's available to get real time. So the Business of Healthcare, and again, this is one that I wanted to show a slide for. This is, again, another popular one. So you can see it's 6 courses, 14 hours, and you can see the continued education credit, and then you can see the topics that it focuses on. So again, pricing, cost, revenue, payment, and delivery models. So Business of Healthcare, again, Module 1 of the CHFP. So why get certified? And well, why not, right? You all have a ton of time on your hands and don't have other things going on. Well, the certifications are actually really great to kind of, allow you to gain that competitive action, to gain that competitive edge, to add this to your resume, to, demonstrate your knowledge and certainly explore other areas that you might have interest in. Another thing I want to mention too, if you are a member of an enterprise membership organization, I would take advantage of this education that's offered, because it's a really great benefit. If you were to sign up for this program on your own, it would cost you $475 per person. So certainly, take advantage of the certification programs. And then certainly, the value for individuals, it's gonna, increase your earning potential. It's gonna make you stand out amongst your peers. value to your organization leaders. So you're going to, within your organization, you can build a culture of learning. Make sure everyone's on the same page with the terminology and keeping up to date with what's going on in the industry. So again, really cool to have these certifications available to you. So these are the certifications available. So you can see the CRCR, the CHFP, Business Intelligence, Physician Practice, Payment Reimbursement, and then Accounting and Finance. So online, all of the testing material, all of the coursework, retesting, study guides is all included online. So it's very easy to sign up, and I will actually demo it on the website and talk a little bit about enrolling for those certifications. One thing I do like to mention is, these certifications, they're not easy. So for some people they might be easy, but many, if you can ask many, that they're not easy. One thing that I do like to mention, so you can go in and go ahead and just test out of the certification. So you do need 70% to pass. They're 90 minutes long, 75 questions. But you can go in, and if you decide to go ahead and just take the certification, and if you don't pass, we're going to provide you with a review guide of areas that you need to focus. The only caveat with that is you have to wait 30 days before you can take the test again. So if you don't want to go through all the coursework, again, you can go ahead and just take the test, and then maybe you just want to focus on the review guide and areas that you should focus on. So these are the 6 certifications. Well, we're launching 2 new ones. And so you guys are kind of the first ones to know. I just got these slides last week. So the Executive of Healthcare Revenue Cycle, this is being launched at the end of the month at HFMA's Revenue Cycle Conference. So this is an executive certification, so it's not for entry-level people. This is to demonstrate revenue cycle excellence. The requirements: you have to have a CRCR designation. You have to have HFMA membership for 5 years. We also want you to have a letter of recommendation. And then there's different levels of professional activity that you have to participate in. So in the different levels, as a provider, you could apply for the MAP award or be a MAP app subscriber. So that's if you're a provider organization. That's one of the options. If you're a business partner, it's sponsorship or participate. So sponsor the annual conference, revenue cycle conference, be peer reviewed, or speak at one of these events. Your other options are service. So there's a bunch of volunteer options if you don't want to use any of those other categories. So again, this is all brand new. There's going to be more detail about this at the end of the month. The next one is Certified Hospital Cost Report Specialist. So a lot of people are excited about this one. So this is to get our accountants ready for cost reporting. So this is a specialty certification for CFOs, controllers, reimbursement directors, staff accounting and finance, cost and budget staff, and consultants. So there is prerequisites around this, and we actually partnered with Forvis. So Forvis is kind of one of the thought leaders in the industry to provide the education. HFMA has built the certification around this in the coursework. So you have to enroll in the prerequisite course with Forvis. It's either virtual or you can participate in their on-site course. And then you have to enroll in the cost report certification and then successfully pass the certification program. So that's another new one that we're really excited about. This is going to be launched early to mid-April. So that's the Certified Hospital Cost Report Specialist. Okay, so there's new leadership courses. So HFMA will provide our members surveys. What are you looking for? And one of the topics that we got back is we're looking for more soft skills, more leadership programs. So, these are some new leadership courses that were launched last year. So 3 components for effective leadership storytelling, 3 key leadership strategies for managing labor and productivity, anatomy of analytics, 7 qualities of an emotional leader, and then 5 facts for leadership on future of healthcare business disruption. So this is the pretty slide that announces those. And then, so I just talked about those. You get 1 CPE for the leadership courses, a couple of other courses, cost effectiveness of health, and then building financial competence in current healthcare environment. So this is the scaled down version of the business of healthcare. So for those people that do not need that in-depth, the in-depth coursework, the building financial competence course is a great alternative. So those are some of the new courses that we're launching. So education and career pathways. So within our site, we already have generic career pathways that are already built within our site. So you can go in and say, well, I'm in revenue cycle. What coursework should I take for a revenue cycle? What certification should I look at taking? Or business strategy, or any of the physician practice management. So those are generic career pathways. Now with the enterprise membership program, you have the ability to build your own career pathways using our learning management tool. So you can go in and say, and we have some examples that we can provide your organization. And a lot of times I like to use the patient access example. So for my level 1 patient access folks, I want them to take these courses. Level 2 might take specific coursework, and then if they get to a higher level career path after that, we would like them to take a certification. So we have a dedicated team or a support person with each of the enterprise membership clients to help build that coursework. I know it's hard to kind of, there's a lot going on. There's a lot of education that needs to be taken, but you can even just start slow with a couple of courses. And so keep that in mind. If you have a specific department that you're interested in and your organization has that enterprise membership, we'd be happy to work with you to build that coursework. So again, these are the career pathways that are built within our site. The last kind of square area I have here is premium facilitated learning. So we do offer on-site or virtual organization training courses. So these can be customized. It could be, I'm looking to do a financial boot camp for my board members or my finance leaders. We've done all kinds. A boot camp for new leadership academy. So there is this, premium facilitated learning. Again, it's just using our instructors to come out and teach that coursework. So again, just letting you know that you can build those career pathways. The online community. So this is LinkedIn for healthcare finance. So here's where you can reach out to your industry of peers. You can send a question or a comment or respond to something, to another person's post. And there's a bunch of different community forums that I will drill into when we look at the website. So there's CFO Forum, Rural Health, No Surprises Act. And again, I'll show those once I get to the online piece. We have the e-newsletters dedicated to our enterprise members, so there is a promos page. And with the promos page, we kind of highlight, what are the webinars coming up? What are new benefits that HFMA has offered? Kind of tips and tricks, but it's just a monthly promos that we send out to our administrators and leaders of the organization that they can kind of push out. Here's some new education that has been developed, or some, promotion or events. So, that's a really cool kind of promotion piece that is just, put together automatically. So data and insights. So there's some new benefits that HFMA recently launched. So some of you are probably familiar with some of these benefits, and this is under our data and insight sections on our website. So, some of the data and insight pieces that have been around for a while are certainly, the MAP keys, the key performance indicators for a revenue cycle. So again, metrics that can be used to measure your performance. The MAP keys are also used in the MAP award. We have the MAP app benchmarking tool to allow you to measure your performance and see how you compare relative to your peers. There's the MAP award calculator. There's salary and compensation data. There's the consumers and maturity module, peer review, and there's a couple of others. I'll actually drill more into these when I get to the website. Some new benefits. So over the past couple of years, HFMA has worked with some third-party providers to, to kind of vet and say, what are some additional, tools out there that we can provide that will provide our members with more value with their membership. So in the past couple of months, we recently launched 4 new benefits. Now, these organizations allowed us to put, some of their tools on our website. They have, other offerings that they would be happy to work with you on. But as a HFMA member, you have access to these. Now, these are only for provider organizations because they're provider tools. But the first one is Guide IQ. So Guide IQ is for market share. It's going to give you access to market share analysis and benchmarks. So, for cost containment, leakage, and I'll drill more into that when I get to the website. Turquoise Health is a price transparency platform. So this is going to give you access to hospital and payer machine readable files. So you can go and kind of sort, filter, and I'll kind of drill further into that. FinThrive offers a revenue cycle, technology, maturity adoption model, and then there's Equity Quotient. So Equity Quotient is going to provide you with data to help with your health compliance mandates. So, IRS tax reporting mandates, American Hospital Association credentialing, so that, health equity, and I'll drill further into that as well. So, all of these are, again, data and benchmarking tools that are available with your membership. So our chapters. So we have 59 chapters. So within your enterprise membership, you are assigned your chapter based upon your zip code. And then, so that's how you get assigned to your chapter. You have the ability to follow 10 other chapters through your profile. So, for example, I'm with the First Illinois chapter, but I choose to follow a couple of the other chapters around me. So, these are the HFMA's 59 chapters. So with the chapter, it's really important to get involved and participate in the chapter. You can see this great event that the Oregon chapter put on for you today, but it's a great way to volunteer. It's a great way to network, meet people. Everyone is remote these days. It's great to get in person and talk with people and strategize and Again, get access to that local education. So, through the local chapter, you can pursue the leadership, opportunities. Again, get involved. It's a great way to expand your network. Attend the educational programs, the webinars. Jennifer's going to talk about the boot camps that are coming up that are available, which is going to help quite a bit with the certifications. So again, this is with the chapter, and I kind of already covered this, but why volunteer? So to learn and to develop new skills. Just by watching everyone participate in the speaking earlier. So in watching everyone interact. So learning, you can gain valuable experience with the chapters, expand your network, which I mentioned, and increase your visibility by making these connections, meeting people from across the industry, and then certainly to strengthen your resume. So for, as far as additional resources, we do have, enterprise solutions where you could reach out to support at any time. So I've talked to a couple people and where they say, we have issues signing up. Anytime you could reach out to, the HFMA support team would be happy to help you to, navigate the site, or, if you're having problems enrolling in the tool. And then, so I don't know if you want to, if I can get this to work, the video. I have one more video, but I don't think it's going to work. So there's a lot of, as far as some new tutorials built on our website, there's a lot of little new YouTubes to help people navigate. And so this is just
Welcome back. Thanks for taking the time to explore your HFMA membership. Let's visit hfma.org and explore the Education and Events menu. Your membership grants you full access to an online catalog of certifications, over 30 online courses, monthly live and on-demand webinars, and more. No matter where you are in your career, we have something for you. With your membership, you'll receive member pricing for HFMA's live in-person events. We host numerous association events throughout the year, including HFMA's annual conference. If you're looking for local events, you can access a list of all events and use the filters to narrow down happenings in your local area. We showcase some featured e-learning courses on this page, including the Business of Healthcare, which is suitable for all career levels and serves as an excellent starting point. Now let's dive into the online catalog for more details. As you explore the online catalog, you'll find tabs at the top to guide you: main catalog, certifications, and live events. On the top right corner, you'll spot My Dashboard, your e-learning hub, showing your progress and completed courses. As you scroll down, you'll find ways to search and filter courses. You can filter by content type, such as live webinars, or you can filter by topic, such as leadership. The results will display courses specific to your search. To explore course details, click on View Details for information on objectives, CPE credits, and more. If you prefer a calendar view, click the clock icon. It displays a list of all webinars scheduled for the year. Keep checking back as we continually add new webinars. If you happen to miss a live event or webinar, don't worry. You can catch the on-demand version for up to a year. Now back to the overview page to learn more about certifications. If you're eager to stand out among your peers, consider becoming certified. Explore our most popular certifications, the CHFP and the CRCR. We also offer specialist certifications in accounting and finance, business intelligence, payment and reimbursement, and physician practice management. For those looking to take their professional development to the next level, we offer the Fellow of HFMA designation. To learn more about these certifications, click on Learn More in the catalog. You'll find tabs to help you determine which certifications suit your needs. A great way to stay on top of HFMA emerging content in the Education and Events section is to visit your member profile and ensure you are opted in to receive HFMA e-newsletters for annual conference, revenue cycle conference, educational workshops, and all the remaining items in the Education and Events section of the Preference Center. Need help? We're an email away. Contact the Member Services Center at inquiry@hfma.org.
Okay, so that was to wake everyone up. And so again, this is just a little navigation tool, video. We've embedded some more on our website to help people navigate.
Step into Wix Studio.
All right, now that we're all awake. So this is Jennifer's laptop, so I apologize. That's why she's helping me navigate. So a couple of other things I want to show. Okay, so this is a cool chart that we have available. I know it's hard to read, but what this is our certification comparison chart. And I know that enterprise administrators have this. I think it's available on our website. If anyone would like a copy of this, you could take my card or email me, and I'd be happy to send this to you. I know they're in the process of updating this as well, but this is a really cool chart because what it's going to do, it's going to give you the program summary behind each of the certifications. So, for example, the CRCR, what's involved, what is this certification going to do? So it's going to give you the program summary. And then one of the other cool things is the recommended roles and titles. So who should look at that should take this CRCR certification? So you have, admissions clerk, billing and collections manager, billings specialist, case manager, claims. So, it's going to show who are the recommended roles for each of these certifications. And I know Jen's going to be hosting that, the CRCR boot camp. So for those organizations that are enterprise members, you might want to think of these roles and maybe talking to some of these folks and getting them engaged and taking that, some of these certifications. So it's also going to give you, just the learning objectives behind each, the prerequisites, the recommended experience for each one of these certifications, the cost. So again, there is a cost if you're not a member or if you're not an enterprise member. And so if you are an enterprise member or even just a regular member, take advantage of these certifications. They're, again, really a great way to build your education. Also, it's going to give you the course details, the credits with it, questions and the assessment. So this is a really cool document that I like to show. And then another thing, this is just courses at a glance. So this is our course catalog. So this is going to highlight all of our courses. Again, I mentioned earlier, you can just do a search. For example, basic billing rules and payment methodologies or billing. It's going to pull up all of the resources that HFMA has around billing, whether it be articles, education, webinars. So it's also going to, show you the CPE credits that are available with each of those certification or education courses. And then also I mentioned to you earlier, you can use these to build education programs along with the certifications if you are an enterprise member. So that's really cool. One thing I do like to mention too, and I showed you that, our membership is expanding because we are trying to get, people more, the younger generations more involved in healthcare finance and really expand, working in this particular area. So it's really cool when you see, I hear stories from people that, I didn't go to college. But I've been using this coursework and these certifications to kind of better, my career roles. And I think one organization I worked with, I think they, one of my contacts was telling me they had a security person that, again, was just excited and is really trying to get more involved in, kind of a healthcare role, and was really excited to take advantage of their enterprise membership. So you kind of will hear stories how there are people within organizations that they didn't expect to really want to take advantage of the benefits with that HFMA has to offer. So, and then I'm just going to quickly kind of go through the website just to help you navigate. So if you go under Discover, and if you go under, membership, if you are an enterprise membership client, you just have to go in, and it's going to, give you the membership categories. And hold on, it's enterprise. Okay, so here, confirm your enterprise membership. So you can sign up. If you are enterprise membership, you just need to sign up with your email. If you are an enterprise member client and you want to use a personal email address, you will need a code to sign up. But you can go ahead and here confirm your membership, and you would just go ahead and fill in your contact information. Complete your registration. Here it's asking for a key, but you just have to fill out this contact, and you'll get a kind of a welcome email once you are set up. So that's how you sign up as an enterprise membership client. So under Discover, it's going to give you access to the membership site, the community, access the online community. So I would, certainly recommend going in and participating in these community groups. You can customize your notifications. So if I pull up all of the groups, so this is the community site. So you have Denials Management Forum, Diversity, Equity, and Inclusion. This is a great way to, post ideas. This is for enterprise membership clients, certifications. There's an international community. Here are the leadership courses, National Network Leadership Connections, and there's a bunch of other ones here. So certainly go ahead and look into those and participate into those. So, and are you participating in any of the communities? Okay, so I'll just see if we could show some of the posts. Okay, so here's, for example, a post from Shirley Hevelin that works with our certifications. She's just telling you that you can get your digital badge right away. So this is just an example. You can see the posts. You could respond to the posts. So those are the community pages. Let me go back here. And I'll just go back to... All right, so another area I want to show within this Discover tab is the Data and Insights area that I talked about earlier. So again, you have all of these benchmarking and data tools available, and we talked about these: Map Keys, Map App, salary and compensation benchmark data. You have Outlook Trends peer review, purchase plans, maturity modules. This revenue cycle maturity model is new from FinThrive. And then these are the new benefits that we recently launched. So you have Guide IQ by Guidehouse. So this is, you can log in. It's going to pull up retention analytics. So it's going to show your organization and how, how you're comparing relative to your competitors within the area. So retention analytics, market share value analysis, and then Medicare per member per year spend. So that's the first one by Guidehouse. We also have Turquoise Health. And again, these were vetted they went through a pretty in-depth vetting process for us to put this on our website. But you have Turquoise verification, initial compliance appraisal, coverage, primers, and then exploratory data sample. So you can sort and filter using this price transparency platform. And then the last one is, let me go back here, is equity quotient. So again, this is going to give you data to help with your health compliance mandate. So public health data. You have public health So equity index information, insurance coverage, life expectancy, poverty, food desert. So this is, again, just data to help with those mandates, for your health, public health compliance. So, some of this might not be applicable to your role, but certainly let others know that are in your organization that, that are members of HFMA. So, so those are the new benefits. There's news articles, so this is where you get to all the podcasts, cost effectiveness of health, the healthcare blame game. So these are all the kind of the news areas, education events. So these are just kind of the main areas that you can, use to scroll. And then career resources. Again, you have those compensation benchmarks, career self-assessment. This is a really cool tool that's available. One other thing that I wanted to quickly drill into, let me drill into my account. Okay. So this is Jennifer's, but I'm gonna, so if you go, again, I mentioned, here's your primary chapter. You can actually select up to 10 chapters if you want to follow other chapters. You can customize your communication preferences. So this is where you would go to kind of, get access to your profile. If you want the magazine sent to you, so certainly keep your profile up to date. And then as far as certifications, here's where you can go ahead and enroll. So for example, you could learn more, and then it's going to give you the option to enroll. Once you enroll, it's going to give you access to all of the study material for you to begin, taking the study material and then completing that certification. So I know that's a lot. Any questions around any of the benefits or anything that I've covered before I have Jen cover the certification boot camps and the certifications in a little bit more detail? Kelly? Oh, she's waiting for that.
I actually have a question for the audience, but I did want to say thank you for coming and sharing today.
Oh,
and
sure.
It's very impressive how much HFMA has developed the tools for enterprise members, so appreciate you sharing with us. But my question for the audience, and this is a no-blame question, okay? So we're in a safe zone, but I want, raise your hand if you are part of an enterprise membership organization. Okay, that's impressive, and we're so glad you're here today. That's why we did this conference, but keep your hand raised. Now, if you have a certification, lower your hand. Okay. Oh, no, if you have a certification, lower your hand. Keep it up. No blame. So, now, no, keep it high, proud. Now, my next question is, have you ever taken an online course from the HFMA website? If you have, oh, good job. My next question is, have you ever done a webinar from the website? And put your hand down if that's true. And my other question is, have you taken a class, one of the classes that's online? If you haven't, lower your hand. So there's a few hands. I'm really pleased to see how many people took advantage of that. But my question's for those that had their hand up, or for your employees, like, what can we do to help our employees take advantage of all of these tools and classes and courses and certifications? Because I know I can speak for OHSU. I would love to see our employees benefit from this. And so you don't have to answer the question now, but please come find me afterwards and let me know what are the things that we could do to help get more engagement and help employees take advantage of this, because I think it's really great education, and we want to promote that for the enterprise members. So come find me afterwards and share too. But
Yeah, share with
thank
me
you for
too.
being with us today.
So it's exciting to see all the enterprise member clients in the room. And again, each of you, or if you're not an administrator of your organization, you have a dedicated person to kind of work with your staff. If you want us to do orientations, or we call them lunch and learns sometimes, They could be, 30-minute, they could be 15-minute meetings. We'll do a quick run through of the benefits to get people engaged. Certainly let us know. They're there, to be your resource and kind of drive engagement. So, all right, well, I'm gonna
One moment.
pass it over to Jennifer.
I think we have one more question.
Oh, sorry.
It's not really a question. I'm Ramona Hernandez. We did a enterprise. I was looking for Evan because I think he was on the call with the UC system. We had, I think, 95 attendees from the UC system take the CRCR boot camp earlier this week. I thought it was impressive. It was a 2-day boot camp, but those are the kind of things that is, I think, very, very, very beneficial to the enterprise member.
Absolutely. And I know Jennifer and I talked a lot about it, and but I totally agree. So she's going to talk to you guys about the boot camp coming up on the 15th. And then one other thing to mention too is, great point. If you're looking for a boot camp, go to the chapter. The chapter events page. You can sort and filter. You can see what's going on across the chapters. If another chapter is having a boot camp, you can participate in that chapter's boot camp. So, for example, if Florida chapter is having a boot camp, you can participate. There might be a nominal fee, but again, if it's a virtual one, they'd be happy to have anyone. You can participate in anyone's boot camps, across all the 59 chapters. All right.
Can you hear me okay? Is that better? It's on, yeah.
Yeah. Here, can you get that?
Okay, I will. Okay, ask you questions. Okay, can you hear me now? Hi, I'm Jennifer Rich. I am the Oregon HFMA Certification Chair, and I've been on this team since 2019, and I'm kind of a nerd about the certifications, so sorry, not sorry. I'm going to talk to you today about things that we're working on locally in our chapter, and I have some slides to go through. There's a lot of them, so I probably won't go through every single one. About this more in depth on the certifications that HFMA has to offer. I do not have the new certification information, so that will be lacking from here. Okay, so Jennifer went over why you should get certified. I'm going to put a little personal spin to that. I have a very different journey than a lot of people. I just have my years of experience, and the CHFP designation gave me an opportunity that I probably never would have had before, and I'm very grateful for it, and I'm very passionate about it. So my why is providing better things for my family, learning more things about hospital finance, and I'm a part of the integrity team, and so it's been a really great opportunity. I got EPIC certified, so it's been really an amazing journey that I've been on. That's my personal spin of why to get certified. So I'm going to skip through these. So she went over the digital credentials. If you get an email from me, I have my little digital credential on there, and it will say CHFP, but it also has your name there. So it's not just somebody cut and paste from a website. It has your information behind it. And like she said, you can display it on LinkedIn. which can attract attention if you're looking for other opportunities. So I'm going to go over the CHFP. There are 2 modules for the CHFP. There's the Business of Healthcare. It is a very robust set of education, has little quizzes at the end to kind of test your knowledge, and it will prepare you for the CHFP test. So you have 2 tests. You have the Business of Healthcare, and it's about an hour and a half. It takes people typically about an hour, and it takes about 14 hours to go through all of the study materials. You can take notes. I highly encourage you to take notes. They are helpful. There's a key concept guide you can print out that will help you with maybe you don't remember an acronym or something. So the modules are the big picture, accounting principles, cost accounting principles, managing financial resources, strategic financial planning, looking to the future, and then the operational excellence, which is the CHFP exam, goes over payers, physicians, providers, and patients. And I'll talk a little bit more about that in depth. So to start getting your CHFP, you're going to enroll in Module 1. You're going to take that about 14 hours of education, and then you are going to take your assessment. And it will tell you immediately if you've passed or failed. If you've failed, that's okay. It's going to give you some things to look at and to study further, and then you can take it again in 30 days. The step 2 is once you've gotten your CHFP, or excuse me, the Business of Healthcare completed and passed, you are going to go into Module 2. There is no study materials really there to go through. You just launch it and go into the test. Or you can connect with the Oregon HFMA certification team, and we will provide you a boot camp. And in September, on September 25th at Eagle Crest Resort, we are going to be offering an in-person CHFP boot camp. It is open to everyone. There is no cost to join. If you want to take, so the first half of the day will be going over case studies and kind of getting your brain ready to take that exam. We'll break for lunch, and then after lunch, you would have the opportunity to take the exam live with a cohort. So you're going to be able to have Tony, myself, John, Robert, and Ian in the room helping you with maybe a tough question that you might have, and or your peers might have an answer for you. The case studies are going to be a mix of providers or payers, professional or hospital. So you're going to get an exam that is a mixed bag of we don't know what. They're all different. And there are multiple choice questions. So, and it takes you get 3 hours to complete the test. Typically it takes an hour and a half to 2 hours. But we're there supporting you, helping you through the whole thing. We've had some virtual and we've had some in-person, and both models have been pretty successful. And we are working on getting information out there sooner so people know that they have time to study and to get ready if they want to take the exam with other people. Any questions? Question?
So just question about open book versus not. Step 1, you can't not open book, but step 2, open book?
I think you can have open book either way.
For both of them?
Because you're going to have your notes
when you're taking business of healthcare, you're going to want to take lots of notes because they're very helpful. And one tip when you are going through this, if HFMA has a quote or a stat, write that down. They're going to ask it, especially in the business of healthcare. Module 2, not as much. They're not going to ask stats as much. They did in my exam, but they've changed the exam quite a bit since 2019. So, yeah. Any other questions? Okay. Once you have your CHFP, you can apply to be a fellow, an FHFMA. So you might see people with their credentials that say Jennifer Rich CHFP. Well, there's going to be other people who, I know John Zimmerling has the fellow HFMA. To earn that, earning the HFMA fellowship attests to one's financial expertise and leadership. And as recognized industry leaders, HFMA fellows act as ambassadors to the profession by raising the standard of practice through consistent participation in professional development activities and service to the healthcare finance industry. HFMA fellows recognize and accept the responsibility of utilizing healthcare finance professional skills for community benefit. And I'm going to go over how you can apply and obtain your fellow. You have to have your CHFP designation. You have to have a minimum of 5 years professional membership in HFMA. Evidence of master's or bachelor's degree, although they did just change this to include years of experience, I believe. Yeah. So that gives people opportunity, again, another door opening up for people who have just worked in the industry for many, many years. You do have to have a letter of recommendation from another fellow who is active or a chapter leader, and then volunteer activity. So you have to demonstrate one of the listed contributions to HFMA or the industry within 3 years prior to applying, which I don't have those bullet points. Oh wait, I do have them right here, sorry. Preparation and publication of one or more professional articles in a publication accepted as authoritative in healthcare industry, service as an adjunct instructor at an accredited educational institution, service in education, certification, or leadership committee role within the local HFMA chapter, talk to me, service of one of the HFMA association boards or committees, demonstrating a minimum of 10 hours in the service or preparation of one of the following: speaking to community groups on healthcare issues, providing internal staff education on healthcare finance topics, presenting at an HFMA educational program, presenting at a related healthcare industry educational program, assistance to those desiring HFMA certification or fellow designation, mentorship of healthcare finance professionals, and there are no fees for qualifying members to apply for the fellow status. Anything I might have missed? No? Okay. Any questions before I move on? Okay. So we're going to talk about the CRCR. The way I look at the CRCR certification is a really good foundation for people getting into the healthcare industry. It's going to cover the full spectrum of the revenue cycle and give you a really good foundation for continuing your career and getting your CHFP in the future. Because a lot of the things that the CRCR covers will be covered in the, it will be talked about in Business of Healthcare, but Business of Healthcare is going to add on to it the finance piece, because that piece is, if you're not in leadership of some sort, you don't look at cost reports, you don't look at those sort of things. So the Business of Healthcare will look at that and get you educated on those pieces. And as Jennifer mentioned, March 15th, we are going to be doing a CRCR boot camp. It's the first one Oregon's done on their own. It will be held at one of the OHSU downtown offices. And I just got an email right before we came up here that the registration is live, and so check your emails if you're interested in that. There's no cost. We are going to go over the study materials in the morning, and then if people want to stay, they're more than welcome to take the test live, or you can go home and take the test on your own. So the CRCR is an online, self-directed, interactive program made of short, searchable courses with knowledgeable checkpoints. Each course takes 15 to 20 minutes to complete. It's interactive. And one thing that Jennifer did mention is you can test out. So you can there's a pre-quiz you can take to see maybe where you need to study, or you can just take the test on its own. And then there are 4 other certification programs that I'm familiar with. And it sounds like we're getting 2 more, which is really exciting. There's accounting and finance, business intelligence, managed care, physician practice management. And the managed care one can be a little bit misleading. Managed care in hospital settings could mean either prior authorization and insurance, or it could be the contracting piece. And this course goes over the contracting and payer piece. So the accounting and finance, it compares various types of budgets, identifies types of cost behavior, recognize the types of risk-sharing arrangements in managed care contracts, and identify capital investment evaluation techniques. This would be another good one to build on to getting your CHFP. The next one is for business intelligence. Identify the concepts and tools of business intelligence, recognize how information for better decisions is derived from large clinical, financial, and other databases, recognize the decision types, analytic tools that are a part of decision management, identify how data warehousing, reporting, and analysis tools and data systems architecture are used. Apply the basics of analytical and quantitative skills of BI in healthcare. There's the the managed care. So examine various managed care care models, HMO, PPO, POS, understand carve-outs, inpatient stop-loss, short-stay stop-loss, and withhold pools. And this, honestly, would be another really great one to help you with your CHFP, especially if you're not knowledgeable in these areas. Examine principles behind outcome-based reimbursement incentives related to pay performance programs. Explore payment models proposed under healthcare reform and their differences. Identify physicians' roles in addressing utilization and quality of care. Identify and be able to utilize key negotiation strategies. Know how payers evaluate their risks. Understand changes to HIPAA privacy laws included in ARRA. Relevant legislative changes affecting Medicare managed care. And the last one is the practice management. Again, another one that will be covered in the operational excellence exam. Recognize the resource-based relative value systems and its components. Recognize the difference between bad debt and charity accounts. Identify processes for evaluating a contract. Recognize Stark legislation and the laws it has developed for regulation of medical group. Identify the elements of managing third-party receivables, self-pay receivables. Name techniques commonly used to measure accounts receivable. And like Jennifer covered, for enterprise, members, it is free. And then individual non-members, it looks like they're $399. Okay. Okay, the next part is certification maintenance. Once you go through your CHFP, you probably don't want to do it again. So I'm going to help you with telling you how to maintain it, and I'll actually go on the website and show you as well because it's a little bit on the tricky side. So for your CHFP and HFMA, to maintain your certifications or designations, every 3 years you have to meet 2 basic requirements. Remain an active HFMA member in good standing and complete 60 hours of eligible education activities every 3 years. Things like going to conferences will help. Anywhere that it says that it's going to give you CPE hours, those are the ones that you want to target if you're lacking in your hours. 3 years, 60 hours, is definitely something that is doable. Even if you're not able to come to conferences, webinars, being able to attend online, that sort of thing will help you. And I'm going to exit this really quick and show you on the website where to go. So I'm actually in the process of looking at the CRCR, and so when you sign up for your certification, you can see here that if you have left off and you need to come back to it, it's going to be under your, under your account. Sorry. I'm just going to go back to the main. It's going to be under, I believe, my development. Is that where we go back? Oh, past registration. Oh, sorry. Just kidding. I thought you could get to it there. Oh, I'm so sorry. It's going to be under e-learning, isn't it? Sorry.
No, that's okay. We covered a lot.
No. Oh, yes. It's under e-learning. So once you signed up for your certification and you need to go back to it, it's under e-learning. So sorry. But to maintain, go back. You are going to go to My Development, and you can see, so my CHFP designation, it was awarded on March 19th, and every 3 years it does expire. As long as you meet your requirements, you'll keep that designation. One thing is watch it, because mine, even though I reported all of my, it was a lot of hours, it said my designation expired, so, but I emailed somebody at National and it was fixed right away. So you can click on that, go to reporting tool, and you can go in and click on, okay, so I tried to use this spreadsheet and it didn't work. So I did individual. So what you do here is, this is your reporting. So you're going to select your activity. So let's say we did a group live, and then you're going to click activity type, and it'll be one of these four. So let's say we're going to report today, HFMA chapter. You're going to title the event, so winter conference. You're going to do start and end date. I don't know how important the location is, but I always fill it out because, again, you don't want to lose this designation. And then the categories here. So these are a little bit tricky. I'm not sure what these conferences would.
Maybe it's just the area. Yeah, if it's revenue cycle.
So just revenues. Okay, okay. So we'll just say revenue cycle, and then the education hours are the hours that were actually in the education piece. And you should get a certificate after every. You'll get a certificate after webinars, and you'll get certificates after you've attended conferences. So there is this spreadsheet upload. There's a template here.
Jen, is it self-reporting, or do you have to also include your certificates?
It's self-reporting. You do not have to include your certificates. That's a good question. Anyways, there's a template to where you can just build on it and then just submit it at the end. I have not had success, but it could be user error.
And you could reach out to our support team,
Yeah.
and they usually get back right away.
Yeah. All of the interactions with National has been really, really great. We've even had someone in the middle of taking their CHFP test accidentally close out, and it kicks you out of the test. And I was able to call, and they reset the test, and she was able to go back in. She did have to start over, but at least she got to go back in and didn't have to wait that 30 days. So that was nice.
Is that both CHFP and the CRCR test that you talked about coming back?
I'm going to go back to the CRCR.
Can you come back to the test and take it, or is it like
No.
CHFP or you have to do it in one sitting?
Yeah, yep. So here's the instructions here, and then you put your data here, and again, you can save it, and then you're supposed to be able to upload it back onto the website. For the CRCR, you do have to take the exam. I believe it's every 2 years.
Every 2 years, yep.
Yeah.
And it's just 50 questions, so it's just a subset of the questions.
And is there any studying material before you take it?
For the retest,
For the CRCR?
I believe it's the same,
It's the same? Okay.
or you know what, yeah, I'm not sure.
Okay. Has anybody done their CRCR recertification? So what was your experience?
Yeah, you could go back in and look at the material, but you could just, I did just take it. So
Okay.
I didn't actually study again or anything, so.
And the materials were the same?
The material is the same.
Okay.
Yeah.
Okay.
I was going to say that document talks about the recertification,
Which document?
the certification comparison, but.
Oh,
that's
okay,
fine. She
okay,
answered our
okay.
question.
Okay, so as long as you maintain, you can just take your, the online exam. And I believe there would be a 30-day wait period if they didn't pass. Is that correct?
I think it's right after, isn't it?
I haven't taken that one before. It's 30-day, okay, that's what I thought. Okay, so that's the end of my slides. Do you guys have questions? Yeah, it is a lot of information to cover.
Is there going to be an option for a virtual CRCR bootcamp?
Yeah, so anytime, yes, we can absolutely do a virtual option for the CRCR. We are talking about just in talks of where our next conferences are going to be. We're in talks of doing maybe in person, like if we go to Salem or something, we could do something in Salem. kind of accommodate there. Or we can do virtual anytime. So the one in the CRCR boot camp in March is the first time we're doing it. So we're going to kind of see how it goes. And I definitely want to build the program to be more robust and offer it multiple times. CHFP is a little bit more in depth, but I definitely think we can offer the CRCR virtually. Yeah. Probably this summer, I would think that we would be able to do that.
Thanks. So like Florida's offering it or Arizona, you can sign up with those chapters and take it virtually rather than waiting for us to maybe do it once a year.
Yeah.
Because like Arizona had one a couple of years ago, and they had a number of OHSU folks that took that class because it was virtual. So there is that option for you if you want that. So we'll try to offer it, but I think the goal with headquarters is that there's more of a national approach on some of the virtual certifications where regions do it together or different states. So rather than us coming up with our own protocol and education, that we're working with other chapters to do it.
Yeah. Any other questions?
Does it work? Okay, now it's working. It wasn't a question, but I will bring up an idea. And that was for some of the enterprise members, do they have internal communities within themselves to help study for these and to share ideas and answer, ask each other questions and.
Yeah, there's the forum that you can sign up for on the website, but we definitely could explore doing something within our chapter. Absolutely. I have in the past offered, if someone wants to have like one-on-one study help, I'm happy to do that. I sat on the phone with someone while they took the CHFP and I just did my job, and she would ask me questions every once in a while. So those are definitely things that we could offer if that's something that is needed, something that maybe somebody doesn't want to go through a group setting. I'm happy to. I love being in leadership. I'm not in leadership right now, but I love mentoring people, and so I would 100% do it. I don't have all the answers, especially with the CHFP, but I'm definitely happy to be a sounding board, and I did take it. Obviously, I did get it. I did pass, and we've had several members pass with our program materials. So I'm happy to offer that. The next slide has our information. Obviously, if you're at OHSU, you can just look me up, send me a Teams message or email me. Otherwise, you can just email me at richj@ohsu.edu. And we do have a nice team with that. I'm the chair, and John is the co-chair, and then Tony's our board member support. And then we have Robert Starley as a volunteer, and also Christy Bishop just joined our team. So, yeah. And if anybody wants to volunteer, I think let Evan know.
Any other questions? All right. Well, thank you, Jennifer and Jennifer, for everything. A lot of information, but it was wonderful.
Okay.